managing yourself from menarche to menopause. So, managing yourself from when your menses starts to when it stops and beyond. So essentially today we are looking at menopause. What did I say? Menopause. So we are looking at menopause. Menopause is actually the main thing why we are gathering because it involves everybody. If I choose one topic, let's say fertility, it will involve just a group. Some people are not longer giving birth to children, isn't it? If I choose maybe a particular disease, some people may not really fit in because they may not have that. They may not be a monitor. But we may not cross across every woman that will be here present. I was hoping that some men will also be here, so they can also know what to do during this kind of period. So, the broad thing is menopause. And I will try as much as possible to be very less scientific. I don't want to sound high. I think I'm not going to know if everybody can understand me. So there will be room for questions. I'll let you to ask questions. Okay? Before we go ahead, I want us to read the passage in Message Translation, Ecclesiastes chapter 12. Ecclesiastes chapter 12 from verse 1 to 7. Can somebody read it in the Message Translation? Do you have a Message Bible? No. Let somebody read. So read the Message Translation of Ecclesiastes chapter 12, verse 1 to 7.
And it says, honor and enjoy your Creator while you are still young, before the years take their toll and your vigor wanes. So
just God will explain. So there will be a time when you are young, and there will be a time when you are old. When you are young, honor your Creator or follow His rules and regulations. Do you understand? Yeah. So that when you get old, the effect of breaking His laws will not be too noticeable on you. Are you getting me? That's it. So continue.
Before your vision hits.
So there will be a time when your vision is going to be dim and you are wearing glasses. There was a time when you can see from here to the junction, you don't need glasses. But as you get older, you need glasses, isn't it?
And the world blurs.
So there will be blurry vision. So you move your eyes, when you see fire is blurry. You need your glasses.
And the winter years keep you close to the fire.
So there will be there was a time when rain is falling, you enter under the rain, and you come back, you are still very strong. What is happening? But as you get older, if rain touches you, start shivering, isn't it? Your temperature control mechanism fails or begins to go down.
In old age, your body no longer serves you so well.
So look at it. So when you are getting old, your body will no longer function at the optimal level it used to be when you were younger.
Muscles slacken.
So your muscles will get weak.
Rib weakens.
Your shoulders will also go down.
Joints stiffen.
Your joints become stiffened.
The shades are pulled down on the world.
Yeah, which is the shoulder.
You can't come and go at will.
So you can't just get up. If I say stand up now, elderly people will get up gradually, isn't it? If you want to do this, no, take it easy, I'm elderly. That day is coming. It will come to everybody.
Things grind to a halt.
So when you talk about teeth grind to a halt, is that the grinders, which are the molars, the teeth, they will come to a point where no longer grind again. And when you are young, you chew bones to everything. But when you are old, you say, Mom, I don't care. Shave me off. My own thing, you start talking about meat. So the summary is that when you are young, protect your grinders so that when you are old, your grinders will still be working. I know what I'm going to. Yeah. So there are things you need to do when you are younger, so that when you get older, it will help you because the time is going to come when all those things will fail.
The horse of the household fades away.
Okay, continue.
They are weakened down by bird song.
Yes.
Heights in the mountains are a thing of the past.
So hearing will go down, your seeing will go down, your vigor will go down. Your sexual libido will also go down.
Even the stroll down the road has its errors.
So when you are strolling down the road, for example now, Mama said, please, I'm cooking right now. There's no Maggie. So I'm coming. Don't run. Yeah, before you are ready, don't say, what Maggie, you've come back. Is that telling you? Yeah. A child is going to come when you go to the junction, you have to take it very slowly. You have to take it very slowly, isn't it? Yeah. So you actually shuffle your legs.
Your hair turns apple blossom.
So your hair will move from the dark color it is now to golden white. As oh, Mama is aging very, very wonderfully, isn't it? Yeah. We all are doing it. So your hair, at least you will see the evidence.
Adorning a fragile and impotent masculine body.
Yeah. So your body also will time will come when beauty will go down, the body will start wrinkling.
Yes, you're well on your way to eternal rest.
So this is actually because we are going somewhere, we are aging. Okay, so thank you.
While your friends make plans for your funeral.
So there will be a time. We have a long way to go, so let's listen. Now, once a woman is 10, 11, 12, the family begins to prepare for something called menarche. When it's the first time the menses will show up. It's a thing of joy for the elderly, but for the young people, it's kind of met with apprehension and being scared. So, when we talk about early onset menarche, it means that a child is, let's say 7, 8, 9, you start seeing the menses, everybody is scared, isn't it? I listened to somebody today, he was talking about a culture where once a lady starts reaching the level 12 and the breast starts throttling, they would go and use the bag of a glue to start beating the breast to iron it, or they use a hot iron. You know this, they call it, I've seen it before, it's called breast ironing. Because what they are trying to do is to use that method to prevent the breast from developing, so that boys will not come and spoil the flower. Okay? But there's nothing you can do about it. That's actually a very bad practice. So from the onset of menses at 13 on average, 12, 13, till when the menses will stop, let's say 45 on average, the woman will keep seeing her menses every month. So you start seeing it, it's a new phase of life. You keep seeing it till one day it's going to come to an end. Now that process when it comes to an end is called menopause. The day or the period in which it will no longer flow. Let's give an estimate from the age of, let's say, 40 to 50, that's my range. Okay, but on average it's 45. But before you make a diagnosis that this person has entered menopause, you must wait for 1 year. And that 1 year you don't see any menses, it's not coming out again. And then you look at the age of the woman, so the madam will think you have entered menopause. So when we talk about menopause, we are looking at complete cessation or stoppage of menses at about 45 years of age, having been amenorrhea for 1 year, because you have not having any menses for 1 year. So that's the definition. And why is it very, very important? It's important because it marks the beginning of some changes also. The same way before it started, the breast was coming out, isn't it? The shoulders start getting very curvy. The hips curvy, isn't it? The breast is coming out. Then there's this radiation, the girls start looking very, very attractive, isn't it? Wow. Then when she's speaking, her voice is kind of deep and it attracts somebody wants to say, hey, you know, when she's singing, everybody wants to hear because the secondary sexual characteristics are setting. Now, what causes that change in a woman is a hormone called estrogen. Okay? The estrogen hormone begins to grow very high and then begin to shape the woman. Another thing that we also have at that time is progesterone. So there are about 5 hormones in the woman's body that will keep going up and down. We have that cycle. Number 1, estrogen. Number 2, progesterone. 3 is luteinizing hormone. 4 is follicle stimulating hormone. 5 is prolactin. Well, that's what I say with record. I can give you the handout. But these ones are not there. Okay? So these 5 hormones will keep changing. So when estrogen is very high, it brings the female's secondary sexual characteristics to come. Right? It's also this hormone that makes the woman to build up fat at particular places, the hips begin to curve. Right? It is this same hormone. Okay? Then when about progesterone, it talks about pregnancy. It's what builds the womb. It keeps arranging the womb, building the womb so that the womb can become thickened to receive the baby. If pregnancy does not occur in that cycle, what the progesterone does, the level of the progesterone will go down. And then the progesterone will go down. And then menses will come out. So progesterone has to do with menses, okay? From estrogen and menses and progesterone, see menses.
I didn't even know there was cake.
Why I'm giving the hormones is because at some point in time, when a woman has fertility problems, for example, she has reached a certain age and she's not conceiving, or maybe the menses suddenly stops coming, the doctor has to do a hormone profile to check which of the hormone has a problem. Normally, when you run your hormone profile, the 5-panel, if there's a problem, you see it immediately. Okay? Or if anything is happening, you see it immediately. So hormone profile is one factor where if you're having a problem with your menses, you must insist that you do the hormone profile. So these hormones keep changing every month. So when it goes up, that characteristics I talked about shows up. For example, why I'm giving this one also is because if you are trying to time conception, for example, maybe you want to time a baby boy or maybe a baby girl, you also need to know your ovulation cycle, how it goes. And it is actually estrogen that makes you know whether you're ovulating or not. How? It makes the breast to be tender. Okay? It's estrogen that makes the breast to get full during that ovulation period. Okay, that's one. It's also estrogen that also makes libido to increase. Like you want to have sex, there's a way you can start feeling. Then the mood swings, it's also estrogen is rising. Okay? Then you start feeling a sharp pain under your tummy. You are watching that the estrogen is rising. So estrogen is keep playing and playing. What progesterone does is to build on the womb. It's working on the womb, it's encouraging the womb to keep growing in size. Then when that cycle fails, that there was no conception, the message just shows up. Okay? So the body keeps going through this process. So you're changing every part of your body, your face can change. You cannot look at somebody and say, I see your face, they want particular people just comes out. You say, no, it looks as if this person is okay, isn't it? Okay, the hormones are also working. So I talked about the breast, the ovaries are where the hormones are actually produced. Then your womb is where the baby will be implanted. So the womb is also being prepared. In that same period, there's a particular place in the woman's body called the cervix. The cervix begins to bring out a particular fluid. So when you put your hand in your vagina and bring it out, you start seeing the stretchiness, okay? It continues to the vagina and say, oh, this is as if I'm seeing my ovulation. Actually, you don't see ovulation, but it's just a sign that something is going on. So those are some of the signs you see. I know that estrogen is playing on me and you can start ovulating. So you must have gone through all that. Now, so when we move from when the menses comes out, you now have what is called the reproductive years. So from let's say 13 or 45, when the woman is trying to give birth to children. So before menopause is what is called premenopausal time. Premenopausal, like pre is before the menopause runs to stop or sets in. And it gives you some signs which we are going to discuss a little bit. Then the menopause sets in, it gives you a time of 1 year of not flowing. And then after the menopause, you know how what is called post-menopausal. All these things have their characteristics, and you have to be very, very conscious about it. What are some of the signs that menopause is trying to set in? Number one, irregular or absent menses. I've talked about it, right? You suddenly realize that your menses is no longer flowing the regular it's supposed to be. Normally it flows from 3 to 5 days. Suddenly it skips a month. And then you're wondering what is happening. Is it that I have infection or it may not be infection? Look at your age and do a hormone profile. You see that there's started giving some sign. Sometimes you can go to 3 months to this see. The second sign is what is called hot flushes. Have you realized that when you go to villages, you see all these elderly people, they like being topless. Right? And you say, Mama, where your clothes? Say, no, leave me. The reason is because they go through a lot of hot sensation on their body. So the only way they protect themselves or to reduce it is just to tie something on the other and leave the thing there like that. And everybody is screaming. Then at night, you have some night sweats and all that. So hot flushes, excessive heat, night sweats. Next is mood swings. We talked about the fact that estrogen will make the woman be moody, isn't it? Yes. But as you're entering menopause, it becomes worse. You just suddenly realize that today I'm very happy. Everybody that comes around, I'm very happy. Tomorrow, everybody is. Where are you coming from? Okay? Your anxiety level also increases, and then you realize that suddenly you don't become restless and nothing. You you are worried about everything. Somebody bangs the door, you scream. What is going on here? Your heart is fast. You don't know what is happening to you. You easily cry. You know that just liability. You can just be happy now and just start crying. And what's the reason? You don't have a reason. Okay? The hormones are playing on you because they're about to. Next is gradual vaginal dryness. So you start feeling that your vagina is becoming dry. The period where your vagina is very, very healthy and very, very rich, flowing with fluid, it begins to get dry at some point. Then you start noticing that during intercourse, it starts being more painful, more traumatic, and then more bruises. Okay? This is actually a sign. Although that before the menopause, there are some times when if you have infection or you are going through emotional crisis, you can have dry vagina. Okay? Those things are just normal. But once you are entering menopause, you see that thing more. Another thing is your libido. Libido talks about the appetite for sex, the desire to move towards your husband and all that. You start noticing suddenly that you lose interest. So you don't do anything about it, your husband must complain and start fighting everybody. So what are the things to do? If you see these signs in your body, you need to talk to your doctor immediately. Okay? I've listed about 10 to 20 signs that if you see, even during the childbearing age, if there's something you see in your body, you have to see your doctor. Number one, excessively menses. So the menses is very heavy. You have to be worried. It can be very normal, right? It just flows 2 to 3 days and it stops. You know that this is fine. That you worry, no problem. There's something you have a very heavy flow and it continues 1 month, 2 months, 3 months, 4 months. Even on the first, second month, try to do a pelvic scan. Don't do a scan. Check your hormone. What's going on here? So heavy menses is a warning sign. Irregular menses before the age of 45. You should also check with your doctor. So suddenly 2-3 months have gone by, you didn't see your menses. You should be worried, isn't it? Ask your doctor, what's going on? I didn't see it. So you just need to check. Is there anything going on? Next is bleeding after sex. Sex is normally very, very less eventful. Suddenly, after intercourse, you start bleeding. You have to be worried. Am I too fast? No. Next is severe menstrual pain. Suddenly, menses have been very normal. Although there are women that go through menstrual pain, maybe by the time they started, there are some people, family also, maybe in some families, your mother had this problem, you have the where before you see your menses, it's war. You roll on the floor, you drink hot water, you take medication before you have yourself. That's normal. But suddenly, you just realize that there's this severe pain you start feeling. It's beyond intensity. And even after the menses, you still feeling this pain. Talk to your doctor. Okay? Next is breast lump. Of course, before you turn 45 and reach menopause, you should be checking yourself every month, especially after your menses. You do breast self-examination to check and see whether you see lumps. Any lump that is there before the menses and continues to be there after the menses should be checked immediately. Okay? Do you get it off the lump? I will talk to you about breast self-examination, the process. There are 5 stages. I will tell you the 5 stages. Okay? Abnormal nipple discharge. That means that suddenly you are doing breast self-examination, there's this particular fluid that comes out of it. Maybe it has a particular color or odor or blood that is going to flow. You have to be worried. Change the skin color. Suddenly, the skin color changes. You now look at your breast. This thing doesn't look like this. Something is going on in this. I have a picture here. I would like to show you that. I say at some point in time, I will turn it. So if you look at this, you see that it looks like an orange, right? This is what is called cold orange, skin of an orange. Now, if you look at it, the pores on the skin are very visible, isn't it? It's a sign that something is happening in this breast very, very seriously. By the time you start seeing that it is hard, the breast is hard, it's no longer flabby and tender. Then you touch it. It gives you this fullness or hardness. Then you start seeing these changes. Even before you see these changes, that's why you have to do it every month. You have to see a doctor to examine you immediately. Sometimes during breastfeeding, you can see this. It's called mastitis. That one, you give you antibiotics to go down. Okay? But once you pass this level, you know that it's no longer acceptable. I'll put it in your, maybe in your platform for you to look at. So that's for the breast. Next is painful intercourse. Sex has been normal, suddenly you realize that it's very, very painful this time around. You have to check what is going on. Okay, there's a particular test you must do. Actually, once you are getting to 40, pap smear, depending on your risk factors. I'll talk about the risk factor when I come over to the theme of today. So there's a risk factor which is multiple sexual partners. You have to do by yourself. From the time your menses started coming out to the time you look at yourself, if you have not done a pap smear and you have had more than 2 partners in your life, you have to do a pap smear and keep doing it every year till you reach 45 and continue to when you are sure that you've done it for like 20 years and you can't see anything. Okay? Next, unexpected weight gain. Try to see yourself, there's this weight changes and all that. You have to check yourself. Then declining fertility rate before you reach the age of 40. Suddenly you realize that you have 2 kids, but it's unnecessarily, it's very difficult for you to conceive. Go and check. Maybe you have what is called early onset menopause. You can set it from the age of 25 these days. There are some ladies that come in and they see their menses once in 3 months. When you run their hormone profile, you realize that they have early onset menopause. That means that what should happen at 45 is happening 25 earlier than expected. Okay? It's called early onset menopause. You have to check. The hormone profile is very, very important. Then you have excessive depression and mood swings. Check yourself. You may not be your entry that period. Okay? There are people that actually go psychotic during this period. Yeah, I know somebody who actually went beyond that. Okay? Yeah, because of that is setting. In fact, the biggest crisis women go through is when they are transitioning in menopause. Yeah. Memory losses, sorry, you start forgetting things a lot, severe headache, low back pain, waist pain, joints, lack of sleep, and cramps and all that. So they can show and cramps and all that. So they can be at a lot of stress. Just check yourself. Okay? So those are some of the signs you should talk to your doctors about. So what are the key areas to focus on? Now, in our Bible passage, we talked about when you are young, remember your Creator. There are things you need to do when you are young. So that when you reach menopause, it will help you and protect you. What are the areas you need to be careful about? Listen, as a woman, you are like a reservoir where everybody comes to milk from. Right? So, the children will, before even they are born, once their placenta implants on you, is to bring out nutrients from you, whether you have it or not. Are you getting me? Yes, you are like the reservoir for nutrients. So, the moment the placenta is implanted on your womb, it begins to suck all the nutrients you have. So, in order to prevent you from going into crisis, your body begins to manufacture excess you have to stored. That's why there's weight gain in pregnancy. Are you hearing me? So that's why a woman has to eat very well. So what do you eat? The problem of nutrition in Africa is a challenge because of money. And yeah, but what do you really eat? And what do you focus on and why? Let's start from the 6 classes of food. We know all the 6 classes of food, isn't it? So let's name them. Number 1, carbohydrate, isn't it? So where do we get them from? We get them from yam, rice, cassava, gari, pasta, right? Fanta mineral, all of them glucose. Okay? Number 2, we have protein, isn't it? Where do we get protein from? Fish, meat, egg, milk, isn't it? Somebody that love all beans. Beans is actually not a protein, but it's more of a carbohydrate. It's a class 3 carbohydrate. So some beans has a little bit, just maybe 10-20% of carbohydrate, of protein. Okay? Yeah, just little amino acid. Then you have the fats and oils. Okay, the normal oils. Okay, fatty food, the butter, coconut oil, isn't it? Granite oil, cashew nuts, all the nuts are the oils. Okay? Then the fats. So fat and oil is the class. What do we have next? Minerals. What do we get from salt, some vegetables, some fruits, we have some minerals there. Then vitamins, isn't it? We have vitamins that fight diseases. Where do you get vitamins from? Essentially from fruits, isn't it? Yeah. Now, as you are growing up as a woman in your childbearing age, you need more of proteins, mineral, vitamins, and fats and oil. Less of carbohydrate because of weight gain. But in Africa, we reverse the order. We take more of carbohydrates because we feel full, okay, and that's what is available. However, you need more of vitamins, minerals, and protein and fats. Find the order if you choose protein, mineral, vitamin, and fats and oil. Right? Why you need protein? Because this protein is where your body is being repaired. As the babies are sucking, the protein is repairing your body. Are you hearing me? Yes. And they're taking, for example, for a child to develop their bone, they have to suck your calcium. So, I realize that in menopause and beyond, women are having bone problem, they are weak, bone needs, they fall, bone needs to be great, because children are collected. So, while you are in your childbearing age, what you should store all calcium. Are you getting it? That's why we go for antenatal. I don't like antenatal drug, it's smelling. No, it's for your own room. They give you calcium morning, afternoon, night, so that you can build up reserve. So that even after that, you still need calcium. So every 1 year, you need to be on calcium one every day. So that you can be building your bones. Because there is a time when you start feeling the effect of your children sucking up on your reserve. Same thing with your protein deposit. Your protein is very, very important. It helps in all parts of the body to replace what the children are taking away. So those are the things you need. Now, when you concentrate in this area and you build very well, you maintain a healthy weight. When you are at menopause, you have nothing to worry because you worked for it. Are you seeing me? Remember when you are young, so that when you get to this age, you are protected. Okay? So, during your childbearing days, concentrate on building nutrient store, minerals. I told some people 2 weeks ago that some days you go to the market, buy this scumbia fish. They have a lot of omega-3 and 6. And eat 2 or 3 of it, they go fry it, do everything about it. Close the kitchen, eat it, and just finish the 3 fish. Okay? It has a lot of omega-3, good for you. So apart from nutrition, the next thing is exercise. Try as much as possible. If you have a car, maybe once a week, at least walk 30 minutes every day for weight control. The problem is your weight and your heart and how you burn fat. Because childbearing age, you are building a lot of fat, isn't it? You are adding, because you realize that your shape is just, it's changing and changing. You are becoming, looking at your mother, and you are crying every day, children, you are finished me. So exercise will help you maintain a healthy weight. Okay? You need to maintain that weight. When you get to 45, you may not be able to run or trek. So if you maintain a regular weight, when you are getting to that age, you don't need to be stressed more because at least you work for it, isn't it? And you have developed yourself. To exercise at least in a week, 1 to 3 hours is very good, ready for everybody. Okay? Then regular health checks of different forms, your blood pressure, because some people have been noticed that we've noticed that their blood pressure increases in pregnancy. We call it preeclampsia. Okay? So you have to be checking your blood pressure. Even after that, you keep checking your blood pressure, your blood sugar, your fasting lipid profile. That's the amount of fats in your blood. You know, checking it. Okay? And then your sugar control. Am I controlling my sugar very well? Am I tending towards obesity, which is your weight and your height? When you go to see a gynecologist, you have to do your vaginal examination. At least in 3 months, you should do 1 vaginal examination. Especially when you've had multiple sexual partners, we'll come to that. Okay? You need to do your vaginal examination. Then your hormone profile. So, we'll jump to breast and self-examination because you need to focus on that. Every month, you must check your breast. How do you do that? Your breast is divided into 5 major areas. You must examine your breast every month, especially after your menses, to check out for lumps and how it looks like. I'll give you a picture here, you have a demonstration. We look at this. We look at this, that's the breast of a woman. It's divided into 5. Look at this side, right? Can you see it? Now, I will show you has 4 quadrants and a tail. So I'm going to illustrate. If you put your hand at the back of your neck, let us stand and do it. It's very good. So you put your hand and let it come out. So the first thing you need is a mirror. Okay? First thing is what? So you stand in front of your mirror and you put your hand behind your neck. Your head, sorry. And then flex your hand back. If you flex your hand back, you realize that your breast will pop up, isn't it? Then you now begin to examine your breast. Now, just start under. This is one side down, the other down, the up, another up. Then you move towards your armpit. That's number 5. You're looking at my picture, okay? I know sometimes you can be lying down on the couch on the bed and you do that. In fact, I prefer being on the bed. So I think I'm lying down on the bed is better because the breast now stays on top of your chest. Right? And then you check in the top quadrant, the lower part, the other side, the upper part, like an orange, 4 parts. Okay? And then the last is the middle or the central. You press on the nipple and check for lump. Okay? And then you move to your armpit. Right? Then you go to the other side, you see 1, 2, 3, 4, 5. Then you go to your armpit. Right? You check for lump. You try to. Now, how do you feel a lump? You will know your breast has been very. You will know when you see a lump. The moment you hold it, you feel that there is a gap. You are catching something within. Okay? After your menses, you just notice that it will go away. Then it's there for more than a week. Just go and check. Okay? That's the next one. So check it every month. Check your breast. So why you are doing with the mirror is because it has to be more accurate. You need a mirror. So every month look at your breast. Every month look at your breast. So those are areas to focus. So I've said it before, menopause can come earlier than expected. We call it early onset menopause. And it's a problem with people who are still conceiving. In this case, see your doctor, run a hormone profile, try to find out the cause, and do it on time so that you don't delay a lot. I know a family, they've been looking for a child for 13 years. And then the woman is 47 now. And all those years, I was asking them, what were you doing? You know? There are some things you know that will happen, and we get to menopause. Now, I want to look for a second wife, or maybe look for options. So you start beginning to be worried, isn't it? Though the age at which you got married too matters. If you got married at 40 now, you will say, let me try 1 year, 2 years, before you know it, you're knocking at the door. So once a man is getting married at 40, 40 something, you start from the day you got married, you start looking for a child, you get a gynecologist to help you, and you pursue it, and know your prognosis. Where do I stand? What do I need to do fast? Okay? Another thing that can bring the menses faster or earlier than expected is contraceptive pills. Of course, every man goes through that. Occasionally, you may take post pill to prevent pregnancy. Occasionally, you want to space your babies and all that. Those things have consequences. It can bring it unexpected. Situations in which women go through, like ovarian cystectomy, maybe there's a cyst, they have to do a surgery. It can also affect the menopause. It can bring it earlier than that. Okay? There are some illnesses that affect your ovaries. A lot of illnesses, infections that can extend to the ovaries. It can also cause premature menopause. Some inborn errors of metabolism. If somebody is born, there's a sister I know among us. She was born with a significant decline in defect in her ovulation cycle. You take the miracle of God for her to conceive actually. Okay? That means she's about 29, but the hormones are completely gone. And 29, gone completely. So think something that should happen at 50, happen at 10. Do you understand? And then when you look at the ovaries, we did a scan of her one time. We realized that the ovaries were like the ovaries of a 10-year-old girl, even when she was 30. Because the ovaries did not develop. So there was an inhibition in the growth. The ovaries don't develop. That's where the hormones are coming from. So it can give you the menses to stop unexpectedly. Okay? In any case. The natural, it's a defect. It's a defect that happened to her. You know, it's a defect. And for her, it was very, very strange because when she asked me, she said, "Doctor, why would something happen like this to me? I'm a virgin, I don't know anything, you know, how can it be? I go to, I start feeling guilty because, I don't know what to say." So that's early onset menopause. Try as much to get a gynecologist to review you so that you meet up with your time. But there will be a time and everything is short. So there is a place for sexual health. Sexual health means that the libido will also fail at some point. Okay? You have to help yourself. Now, depending on how it has been, as you go older, your libido will go down. Partners will complain, depending also on their own libido. Okay? There are some people that survive more, maybe in a week. Somebody was asking me, "Doctor, how many times in a week?" Well, depends on the energy. When you are younger, 7 times in a week is okay. It's too much, right? The truth is that, let me tell you, the truth is that some of the, hello, the truth is that, let me tell you something. Why do you think, there are some issues that have to be discussed, isn't it? Why do you think most men are polygamous in nature? It's because of the libido. So what happens is that you can't get everything from your wife. So I'm talking about the war system now. Don't misquote me, right? I'm trying to put you in the man's mind so you can understand why they play for sex a lot. So the same way in your brain, you love shopping and pictures, isn't it? If you are not going for shopping, I'm not taking some pictures, you are sick. The man that don't have sex is sick. That's the build-up of a man. So as you are getting older and your hormones are turning on you and you start starving of sex, be sure that if it's not giving you problems, it's getting it from outside. I'm sure about that. I know a lot of things that I cannot be saying everything here. You know, as a doctor and a pastor, so there are a lot of things that I know that I cannot say. No. No, because the reason why I'm saying this is because this is faithfulness in the home, isn't it? That's your thing. You need this thing to have an idea. Because not every man, not all of your husbands are born again. And not all of your husbands are staying with you. Some of your husbands are living away from you. And those things have implications, isn't it? Are you hearing me? If your husband is living away from you, there are implications to that. It's not everything you tell a woman now. If your husband, let's say, lives in Europe and comes here every 2 years, you cannot tell me you go to Europe and just stay and waiting for you when we meet each other. Yeah, if you take a highly born again man with discipline, we need to talk about this issue because this is faithfulness. You know I'm going to this place. I need to talk. What is the theme of the week? Faithfulness in the home. That's why you have to be careful. That's all. You have to watch how your body is so that when anything is happening to you, say, something's happening here. Something happened to my husband. February. So she came to me and said, "I'm having a problem." I said, "What is it?" "I think your brother is cheating on me." I said, "Hey, that's not true. How do you know?" "I'm carrying the, I know how my body is. I don't notice that something has changed. I know myself. Check me, do every test you can run on me." I run everything on her and I noticed something. So about 2 days later, that my cousin came out and said, "You know, wrong with something. Then we come she feel, Then we come she got I hear you know. So I realized that the wife had noticed it before he came. Yeah, women are very sensitive. That's why you have to be very sensitive. Okay? There's nothing wrong when your partner comes back home after 6 months waiting to say, honey, you have this thing, but let's go and check ourselves. Let's just see a doctor. I'm not saying anything though. I'm not saying anything. Let's just check ourselves. Let me tell you, there's a family I know. I go to give them HIV drugs. I have 2 families, husband and wife. Their drugs, I'm going to supply their drugs. So every month I'm getting them supplied to husband and wife. But it happened 5 days ago when I discovered them, because they brought them to me. Then I was asking the man looked at me and said, Doctor, this is my how many years? I've not gone anywhere after my wife. The wife also told me the same thing. I believe both of them, but they have a child. God bless you. Where did it come from? If you are doing it, who will you talk now? How do you find out where it came from? I have 2 families, you understand? Until today, where it came from, nobody wants to talk about it, and it's not important. Because both of them have it. Okay? So it's very, very important to seek help early and to keep checking yourself, especially when you notice partner infidelity. Okay, or staying away from you. I just gave you an idea that there's no way a man will leave you for 6 months and you know his level of Christianity and faithfulness to God and come back to you and nothing happens. I will doubt it. Okay? I have a lot of things, I have a lot of stories. Some time I would have told you a couple of stories that you can get to know about. Why is it important to check yourself, especially when you notice that there is a virus called human papilloma virus? It causes more damage in women, but it is actually transmitted from a man. And it causes cervical cancer. It is the most important sexually transmitted infection in a woman. HPV, human papilloma virus. That's the reason why if you notice WHO is giving vaccines to children now, called HPV vaccine, is to prevent that infection. We know that 99.99% of women who have it got it sexually. Okay? That's why you have to check yourself. And come to the area of multiple sexual partners. From the day you started seeing your menses at 13 to where you are now, let's say you are 39, 40, 41. Look back, how many partners have I ever had? If you have had more than one partner, you are meant to be checking your cervix every year till when you turn 50, 55. Every year, check for that. Look out for pap smear. Your gynecologist will check you out every year. Do your pap smear. Some people do it 6 months, next time it's almost free. Private hospital is about 15, 20,000. Do your pap smear, EAP, for particular test, pap smear. Every year, check yourself, okay? Are you there? Yes. Is it interesting?
Yeah.
Thank you. Now, bacteria lives with us. Do you know that?
Yes.
There's bacteria in my mouth, my eyes, everywhere. They live with me. They are called ubiquitous organisms. We've noticed that if you culture a husband and a wife and there's no third party, the bacteria you see in this person is exactly what you see in this person. It's shared among them. That's the reason why when there is a third party, notice it. There is a disharmony in the amount of bacteria they have and the kind of bacteria they have. So when there is a third party in that union, talk about the vaginal area, okay? You will notice that we got a bacteria somewhere, we brought it into the union, and it begins to spread. Okay? That's why you have to be careful. It also goes that kissing will share bacteria, isn't it? Have you noticed that if they give birth to a child newly, and they start knowing that, oh, maybe you're cute, soon that baby will develop cough, catarrh. Why? You come kiss, I transfer this same joy, I kiss the child, by bringing things to the child. As the immunity is not well developed, before you know it, the child goes into a crisis. Isn't it? We can also use that baby to also share bacteria among ourselves. I mean, if you can shake somebody now after going to the toilet, come and shake so the person can pick bacteria, why not this thing, you know? You can pick some very important strains. Okay? That's why there's importance of partner faithfulness, because this bacteria control how things happen between both of you. As you are having intercourse and bonding together, the bacteria are sharing each other, and they're happy because it's coming from both ends. Okay, it's helping each other. Then this person have their own. They have gone through wide strain and transformation. Because bacteria also changes based on the antibodies and the exposure to antibiotics and all that. They bring it to this union that's supposed to be holy. And this is why the Bible says that a union is supposed to be holy, beg on the fire. This is actually what it means. Don't go, because if you do that, you are introducing something that you don't know anything about. That can cause problem. Okay? We should handle these issues well. I wrote some things down here. Let me tell you. Today before I left the office, I was writing this thing and then a woman came to me. Doctor, I want to ask you a very important question. If a woman is AS and her partner is AS, what do you do? I said, well, before the marriage, cancel the thing off because it's not work. So we're already married, what do you do? I said, why did you do test? Oh, before we married, we did test. They told my husband was AA, me I was AS. I've always known I'm AS. But suddenly now my husband is running his test. They say it's AS. We've gone everywhere, my husband is AS, I'm AS. What do we do? I wrote it down here. When genotype becomes a problem, expect marital infidelity. I know a couple in this town, a very rich man, has more than 10 to 20 trucks, oil trucks, for diesel. So what they do is that, because there's a test you can do on a pregnant woman at 10 weeks, you take a sample to check whether is the baby SS or AS or AA. So if they give us high risk, we abort the pregnancy. But that couple have been doing that. They have 3 children now. They go to India to run that test. You know, it drains the family resources. So one time the woman came to my office with bruises all over her body, and she's very fair. Everywhere, my mother, what happened? She said, my husband. I said, what happened? You know, I was questioning my husband about this girl. My husband started mixing me and all that. And then it turned out that my husband has 3 children outside, apart from the family. I just looked at her and said, I looked at her and said, no. I know the one that told me your husband is AS, you are AS. Go and thank your God, though, that the man kept you as his wife and have 3 children outside. Protect your marriage. Don't be nosing around. You're my friend, I'll tell you the truth. Because what the man wants to do is to be safe. Because the man knows what he's going through with you. And if what if, okay, you want the marriage to break, I don't want the marriage, I want to remain in my marriage. Share it. It's simple. Africans are polygamous. I'm going to you as a doctor. I don't want any sentiment. I just know what I'm telling you. In that case, don't protect yourself. Be careful and all that, but just leave the whole thing and then move on, because the man has a genuine reason to look for a second wife. I know what I'm telling you. Yeah. Don't go and kill yourself. Not what. A pregnancy, if you are getting to 45, 50, and is a legitimate marriage, and baby is not coming, discuss the option of adoption with your husband. Are you hearing me? Discuss the option of a second wife with your husband. Discuss surrogacy with your husband. I've done surrogacy for people. So, discuss that. My husband, I'm getting this age, we need more children, in order to protect our marriage. What do you think? I'm the one that is suggesting it now. Let's do surrogacy. I believe like, look for a young girl to carry the baby for us, so that we can have a child. I've done that for people. In fact, there's one that just called me this morning that their baby should not. Okay? All you do is to negotiate with the lady who carry the pregnancy, get the doctor to implant and that thing. Okay? It's both ways. As you are nearing that time, to also insist if there is a fertility problem, partner must check themselves. Men always believe that it's not from them. I'm okay, I'm a man. It's a lie. Once there is childlessness in the marriage, we should try to check from where it will be coming from. Most men have no sperm count, they don't know. Because you get older, the sperm count drops. So if you find out that, in fact, there are many men I have that don't even have any sperm, but they ejaculate. Okay? In that case, what do? You consider what is called sperm donation, IUI, isn't it? The one that happened this morning was an IUI now. You got a donor, a young guy from Institute, just paid them 120, 300,000, they just leave it, go away, they don't come back. They plan to have, you conceive, and that's it. You have your baby, nobody give you problem. Okay? It's very legal, you can follow the right process and get your child on time. No long story. And I wrote something here. I wish a man would have been here. I wrote here, if in case of rape, your wife is raped, what do you do? You know, when I have a family, I have a young woman, I think she's 32, she was raped, and she did not know what to do, she hid it from her husband. Then when the time came, now I'm pregnant. How? Why didn't you do something? So when anybody is raped, that same day the person is raped, what do you need to do? There are 4 things to do. Number 1, rush to see a doctor to do STD check. Because in that STD check, you can also have HIV visiting. What the doctor can do is to give you what is called post-exposure prophylaxis. To give you something to destroy HIV, hepatitis B and C, you are free. On that same day, within 72 hours, make sure you see a doctor. Tell young people, spread the message. Don't allow them to hide it. Rush to a doctor and say, doctor, I was just raped, now what do I do? They give you the exposure, prophylaxis, and you know HIV is gone, gonorrhea is gone, chlamydia is gone, that one is taken care of. And they will give you a post-pill. Pregnancy is gone. You don't have anything to worry. Don't come after 3 months and tell me it's rape, you are hiding it. I mean, that's foolishness. Do you understand? Because there are most, in fact, there's one I know now that has HIV from rape. I'm shocked. Because by the time she shared her story, in fact, one day she wanted to kill herself. So she came to my office and said, doctor, I came to say goodbye. I said, thank you, bye. I Then she now said, well, you have been very good. So anytime you speak to me, my heart will go. I see the walk over in my heart. I don't want to break your heart, so I will tell you before I leave. I said, what is that? He said, doctor, I want to kill myself. I want to tell you first. I said, you tell me that you kill yourself. I allow you to kill yourself. Anyway, long story short, by the time she left my office, she was smiling. And she's alive. But I'm still scared. Okay? How did her own happen? Rape. So those are things that should happen. The first day, the day it happened, just inform a doctor, rush and say, doctor, do everything possible. Do everything possible. And it can be done. Within 2 hours, you are free. Nothing can go beyond that. Okay? So I'm talking about.
If you know anybody like that, contact me.
She's all together at that point. So she knows there's something. If you have anybody on rape, okay, in the home, you have seen married women that have been raped. Okay, don't hide it. Are you hearing me? Hello? Or your daughter, anybody, they need to do that. Okay? Then, concerning partner fidelity, you know, we're under faithfulness in the home. As you get older, libido drops. What if you are 35 and your husband can no longer perform again? Maybe you have diabetes, no erection, and your libido is high. What do? You try outside as a Christian. These are issues to discuss, isn't it? Because we are human beings. You know, there was a time in medical school. You know, in my medical school, they used to tell us, an abortion. Everybody will say, no. People that do abortion, for example. The teacher now said, you there, you say, no, I'm not going to do an abortion. Say, stand up. Okay, assuming no, stand up. As you are your exam question, assuming you are the husband of a woman that got raped and she got pregnant by a doctor, and your wife is emotionally traumatized, what are you going to do? You this doctor that not do abortion, your wife was raped or your daughter was raped, and you know it's an abnormal. What will you do? Will you afford the baby or not? It's an area of complexity. Yes, so those are things that once you start saying, no, me, how can Christians do this? How can we do that? How can we say this? Hello? You know where I'm going to? Do you know where I'm going to? It has become a problem. It's an epidemic. Epidemic of husband and wife is around here. And either seeing another man or using a sex toy. It's an epidemic. I'm telling you. It's an epidemic. Even in the church. Let's want to discuss that. So I'm not going to give you an answer. You will get the answer from my discussion. Yes. Isn't it? Yes. You know, sometimes you don't tell people answers. You allow them to think and make decisions. Isn't it? Because those decisions have consequences. One time, I was giving a health lecture inside the church. So I asked them to write their problems and give to me. So someone wrote that, "Doctor, is masturbation a sin?" And he wrote. So when I look at the whole 3 people that wrote that same thing in different ways, I have to reframe my lecture that day to address that issue. Then I now make a statement that if you're having this problem with masturbation, come and see me, so that I can guide you and help you, so that you can see that it's a habit you need to overcome. Okay? But when partners travel from each other, 2 years are gone, you've not seen your husband, you are burning. What are the options available? When I come to church as a pastor, I will tell you, oh, holiness and all that, but I know people come to my office and tell me they are using sex toy. Are you getting me? Yes. I'm telling the truth. There are many big people I know, women and all that, so that their husbands bought it for them because they cannot perform. Do you understand? I'm telling you things that we have to. Things that we have to. And that's the reason why when you come at that level, as a doctor, you cannot condemn anybody. You get what I'm telling you? You cannot condemn, because the only thing you can give as an option is that let me do the last one. The woman has a boy and 2 girls. The husband has been in the US for 4 years, they have not come back. But they come back at least and see the man doesn't want to come back. He has to pass over. Then one day, I don't know, one thing led to another, a call. The woman now realized that he has a wife there. Of course, like I said, they will not be there, they will not have wife. So it became a problem here. And then you know all this agitation, anger, she's emotional, she's crying, she come to my office, she will stay for like 30 minutes, come everywhere crying, don't know what to do. All she wants me to say is that, okay, divorce your husband, you move on. As a doctor, you know, you have libido, you have to. I can't do that. They're going to use me and do the soup. What I will do is present the facts to you to think and to consider. Is it your marriage? Is it worth fighting for? Is it worth fighting for your kids? If you leave them now, who are you leaving them for? Where are you going to? Where do you think you are going to when you go there? You know, there is a research that 80% of women who divorce their husband end up in the house of married men as side chicks. Did you get my illustration? Yeah. So you left the husband for infidelity. And then you became a second wife or side chick to a married man because they don't put out provide the money. Are you getting my point? So you better stay where you are, because our grandmother said, our grandmothers managed worse marriages than worse, and they survived it and lived for 60 years. Then one day you come home and you are crying, you want to kill yourself. But I say, madam, whatever I'm not eating, come on, go see food. Come on, go see eat like it. We eat child, come. You look tired about it, that do you think your father was a holy man? This is your father that you are calling holy. Then you wipe your eyes and realize that it's a universal problem. All you need to do is to know how to protect yourself and pray to God, and then take measures to help and communicate and then solve the problem. Peradventure, God will touch him. Isn't it? Because you don't have to do that. Anybody going out of you. In fact, there's a man that came down from US. So you're gonna say, oh, my wife, my wife had bought packs of condom and gave me and said, my husband, they are going to Africa. Please take this. Don't bring back any infection to me, please. I will check you when I come back. Do you understand? Yeah. The man has been here for 9 months. American is here, he's still around. These are issues to look at. If your marriage is worth fighting for, okay, if your righteousness and your holiness is worth fighting for and being patient around, then you now know the option that your husband travels, you know what to do. Or you travel away from your mom, your wife, and all that, those areas and what to do. Do you understand? And when there are issues of conception, what to do. Let me give you the last story. In January, I was managing a woman for iwuala, and I said the husband has no sperm, and I needed to spermatozoa. I needed to let them take the donor. We got to the donor 1, 2, 3 times, it didn't work out because that process is actually very dicey. So because of the cost, it was very expensive, spent like 500K every month. So they have spent money. Then one day, the woman called me and said, I have pressured my husband, and my husband had approved me to go outside, and I said, any man I see, and bring back anything, just to get pregnant. I said, oh, interesting. But I told her that there are consequences of doing that. There are evils. The moment your husband knows that you are sleeping outside, maybe for greater good, he will stigmatize you. So you are affecting psychologically and all that. So in order not to kill your husband before the time, I would suggest you keep doing this item or you adopt, because there are consequences for your action. I'm not saying it because of me that you are giving us money to run this procedure, but I'm looking at your marriage long term. Is this what you want? That you come, your husband can actually walk out from the marriage, because there's something you do tomorrow, look at you and your child and just walk away. Nothing to fight for. So I opt for the option of adoption or be patient, keep doing the procedure. So I didn't know, let the voice chat and then. So in January, the man came to me. So, doctor, we want to see you. I said, okay, I'm very busy today, I'm very, very busy, but I'm at Insu Junction. Can you come? They came to the manager, they bought food for me, what please? I explained everything to the man. Now said, doctor, you know why I came to see you? Joseph told Pharaoh that you need to prepare for famine. Pharaoh now asked Joseph that, if you have this idea like this, why not you be the prime minister? So I don't know where you're not done it. So I said, okay, I understand. The man has said, doctor, you have been recommending people. I listen to your chat to my wife. I know you're a good man. I like your spirit. Donate for me. So, you know, yes. So I look at the man and say, oh, that's okay. Well, no, I said, well, it's an honor to accept the better, but as doctor, we sign oath, and ethically I'm not meant to do this. You understand? Because one, I know you know me. Tomorrow I may feel something about the child, not for the child. Yeah. And the government will have to my DNA. No matter what I sign, if I come back and I told my Lord, I didn't have to be my baby. I don't want that kind of situation to say that's true. Ah, doctor, you are very intelligent. I say, yes, that's what the profession has guidelines. So I don't go beyond. I know a doctor, I know him personally. Not they tell me. It's the women that he did it to that came to tell me. Once the doctor see opportunities that the husband cannot get it, he helps immediately. He has kids everywhere. Hey, I know. Are you not telling me? Yes. So it is that bad that the nurses, when it is happening, sometimes the nurses have to run over and walk the door. Are you not telling me? I know the personally because so those are areas to look at, and I'm leaving the answer as a broad answer so that you can think about the idea of partner faithfulness. Truth is so that your marriage and your righteousness and holiness is worth fighting for. So don't give up. Don't say because the husband cannot perform now. You have to now do something after it's your right. Of course it's your right, but there are consequences, isn't it? Hello? There are consequences. Okay? So I've talked about the warning signs. Now, what do you do when you notice all these symptoms I've talked about, the conglomerate? In summary, as I wind up, have a gynecologist and see a doctor. Discuss with your doctor everything. Make a decision with your doctor. But it doesn't mean the doctor, it ends with you. Because this is a patient managing themselves, their doctor. Sit down with your doctor and work out a strategy on how to go about your life. Okay, thank you very much. We want to entertain this. So we want to entertain questions. I spoke a lot, so I want to entertain questions. Maybe if you bring up the question now, we are going to now balance it from where I missed or where I did not take into completion. Mama, go ahead.
There's age limit to certain diseases like depression, age limit, like when you reach menopause, you no longer have
That's what I mean. Ask yourself, Papa said that you asked me.
Sorry.
Yes, the woman is expected to ovulate every month. However, it doesn't happen all the time because of conditions. Ovulation can fail. Well, so we call it anovulatory cycle. That this one is not ovulatory cycle. Okay? You can just have to check and ultrasound and also do a hormone profile. You know. So that if there is any issue of conception, maybe you're trying to conceive and then it didn't work out. Find out whether that ovulation did not take place. I now know what the next time. So, yes, ma'am.
Praise the Lord. You were saying something about certain for women. What of whether it's women or not? What of widows? Is that widows? How do they take care of their sexual urge, or how do they manage themselves?
Listen, I will try to tell you that modernity has come in, understanding has come in, okay? If you ask me, widows, let me tell you, a man came to my office last year. So, also doctor, in my own one modern science, and I'm a widow, I've been a widow now for 20 years. I let them come in, my daughter, I'm a grandmother. I'm a doctor, I'm helping myself. I'm for 15 years. And I told me how long for a reason. I'm noticing now. What would I have a lot of infection. So I want to leave the man. Because the man pays my bills, the man goes to the man does that, the man, and this man, they are very close. But the one was the person that opened my eyes to what is happening in the States in terms of high level meetings and all that, and how they take girls there and all that. I was shocked. Do you understand? That is one way. And she's an unbeliever. What do I do? I cannot be condemning her. It's because she came and told me. So my job at that point is to advise her on the risk factors involved, run her pap smear, run this, run check, and all that. Okay? Now, there are people who cannot afford that kind of a life crisis. And then, even the unbelievers, some of them are still using sex toys as widows. I'm giving you an example I know in this town. Okay? Then, as a Christian, you have to weigh the option of your righteousness and holiness before God and the sex toy, because I don't think you can finish using a sex toy or masturbate and stand before God uncondemned. The devil will condemn you. Your conscience will be condemned. You feel unclean because masturbation itself is an unclean habit. There's nowhere in the Bible they say thou shalt not masturbate anywhere. But it's an uncleanness in itself. It's uncleanness significantly. Are you getting me? So when you look at where you are going to heaven, it necessitates you to curb your excesses and say, well, for the sake of the kingdom, this is the price I have to pay. Or let me be honest with myself and remarry. Because the Bible gave you an option to remarry. That for the young widow, they should be advised to go and marry. Did you know that it's in the Bible? Don't come and deceive others because they have 4 children. But you have men who are sleeping with outside there. Why not opt to go and marry? So that you will not be in sin. Because there's an option like that. Then the husband man also that have that problem. Instead of you to have that, why not opt for the option of polygamy and open with it, let it be known. Not to be having 3 girlfriends outside. So you will have to talk about it. I'm giving it options so that you can discuss it and communicate. Hello? Yes.
And sex toys. This question. You know why I don't like you guys this question? This is a Christian gathering. And the Bible is so clear about it. For instance, I'm a living example. When I talk about myself. We are Christians. We have the Bible there, guiding us. We go and read Timothy. If you read Timothy 5, you see all the things. If you are going to born, or you want to share people's husbands, or you are help people's children because you want sex, you are making yourself a public disgrace. And God will not take care of you. You are on your own. I have a friend, my age mate, who became a widow before me. She was 34. My own, I was 40. She said God knows that she needs a man. I said the Bible says you should go and remarry. Simple. And the beautiful people are coming to marry.
said there are
two friends
consequences.
like that. They are sick. Most of them in para. So you think gentlemen start off with 10 years because they decided to live their lives anyhow. I can't not children of that, so do anything. So the Bible is there to guide us. But I won't go and do too much. Praise the Lord. If you want to be married, you will marry.
So we're given the option. That's why I said they should discuss it with their husband, themselves, and family. Don't be under pressure because there is a consequence to your action. Hello? We're talking about faithfulness in your home. Why I'm here and open up to all of this is because there are a lot of things that will be happening, and you don't know it is happening. Only to come down with a particular problem. Are you hearing me? Are you hearing me? Yes. HIV, hepatitis, gonorrhea, chlamydia, those are actually the cervical cancer you're talking about. And all these things are sexually transmitted. But you cannot just be ignorant. Don't know it in your heart that your partner is not with you. There is a possibility anything can happen there. Okay? In order to be healthy and maintain the union, when he comes back, use joke and say, "Oh God, I hope nothing. Let's go and check ourselves. Oh, you know these people that have come for the same infection is there. You know, we go and check ourselves. Oh, so that you protect yourself, isn't it? Hello. So run your test and protect yourself, right? In that area. Yeah.
Praise the Lord. Not having adequate sex or any effect on women in particular, and over a particular range, I can see that the person is not having adequate sex, and that is why what is causing this to that in the person's life.
Okay. There is no yardstick to what you just said. Meaning that if somebody has 2 times or 3 times, some people once a week is enough for them. Some people 7 times a week is not enough for them. It is person dependent. Do you understand? So medically, there is no amount. What the books told us is that for proper conception, couples need to have intercourse 3 to 4 times a week and regular. Do you understand? So the limit is 3 to 4 times a week because it is assumed that Monday you skip a day, Wednesday, so when they come in and they are not conceiving, we ask them that history. How many times do people have sex in a week? They will start telling some people come and say, sex, is it water? Once in a month now, once in a month can get you pregnant, isn't it? For it to be optimal, the idea is 3 to 4 times a week and consistently for 1 year before you can say there's a problem. So don't come and say your partner is in Lagos right you are not getting pregnant. The reason is because there is no adequate sex. So for your question, there is no amount that is unique. Just like beer, for example, you are drinking wine. When at what point do you say it's too much? There is no line. A little pint can harm somebody's liver. And there are people that have been drinking for 40 years, nothing has happened to them. So it is individualistic. Some people have high libido. Some people have low libido. If there is a union, the solution is communication and understanding. Are you hearing me? Then, if you don't have sex for a year, the only thing that will affect you is mentally. If you have not had sex for a year, the only problem is your mental state. Hello? Where you have problem is your mental, it's your mental health. Wait, let me conclude. Do you know what is mental health? How you feel, your happiness, your sorrow, your mood, how you respond to swings and all that. Sex in itself is curative, it has a healing effect. It has a lot of calming down your body. Do you understand? So sometimes you are there, still to have sex for a long period. That's the only thing. Medically, what will happen to you? In fact, you are safe because there's no effect, no pregnancy, no nothing. because that aspect, you are going on the road, you are not happy. Man, you just shout on the person. Do you understand? You just feel that the word is going to show that it's kind of, you know. But once it does happen, everything is good. Yes. Then it comes before we said a warning sign, especially after menses. It has stopped for 1 year. Then suddenly you start seeing abnormal bleeding. You must do your scans, hormone profile again, pap smear, and the doctor must investigate for what is called ovarian cancer. That's the earliest sign of ovarian cancer. Do you understand? Which is womb cancer. And it is a resumption of menses again. It can also be a sign of fibroid. It can also be just a hormonal disorder or infection going on called endometritis. Just see your doctor to check you. Just check immediately at that point. Okay?
Praise the Lord. Now this question I want to ask. We are our team is faithful. Praise the Lord.
Okay, when someone is asking questions, one person at a time.
You know, our team is faithfulness in the home. Praise the Lord. That you will get here to try on. Praise the Lord. Somebody came to me last week. Praise the Lord. A woman came to me last week. They went on to.
Dear with HIV negative. In fact, the one is asking me, is there any way you can take the virus like an hypothesis? Can we calm down? They have gone away, I'm saying you before God, they have gone away, and don't be angry, don't see me like us, don't feel bad that if you are not, there's no longer woman in this world, there's only that it's only you are married. If I don't marry you, I will die. The woman said, you cannot take forward one charm, you will not charm anything. The partner that is for you and tell the husband that see who I am. The husband said I must marry you. And the man is HIV negative. Surprisingly, the man has no problem. He has refused to take treatment, he doesn't protect himself, he's even wishing to have the HIV. I am telling you me, I'm not saying somebody, I'm not saying you, I know that. I'm not being a so you can carry a problem in your heart and tell me that your husband is high there. There's the husband you will talk to. I said, this is my problem. Let me tell you, in this country, in this country, there are many people that were president that married 2 wives. Their main wife that they brought to the public had no child. They married the second wife that was giving birth to children, and the one that was in the public was the political wife. In my community, I have somebody like that. She's a politician. The husband had like 8 children. None came from her. And they never saw that woman because they paid the woman and said, you will not come out. And she gave birth happily. And the marriage was, the woman, when the man died, the woman was the one that buried the husband. She had no child for him. But they have 8 children. Do you get my point? It depends on the law you have and the prayer and the favor you have. So all this hiding and doing things that you're not supposed to be married. If you are having a problem with unfaithfulness in your marriage, talking with your partner, deal with it. If you are young, your husband is late, remarry if you don't have the capacity to stay alone. Are you getting me? Because there are consequences to that. There are a lot of infections that are going around. That's the one we don't know anything about. They are coming up everywhere. Protect yourself. Are you hearing me? Today is my wife's birthday, so I want to wish her a happy birthday. So I can join us for the day. Praise God.